And we have come together in Congress on a bipartisan basis to reauthorize PEPFAR at a cost of $39 billion for HIV and AIDS for the next 5 years. It's a $48 billion bill in total. We've not had, though, the same sense of urgency when it comes to fighting AIDS at home. I'm on the Appropriations Committee. I'm on the subcommittee that funds both our foreign operations, our development assistance initiatives, and I'm on the subcommittee that funds all of our health initiatives in the United States. And I'm on the authorizing committee, the Foreign Affairs Committee, that authorizes all of our foreign policy and foreign aid legislation. And let me tell you, I know from the inside that our strategies have not been very focused. We begged and pleaded for money for the Minority AIDS Initiative. We can't even get to $600 million. We should have had $600 million in 1999 for the Minority AIDS Initiative. And so now it's time to provide the CDC with the funding and the tools to carry out its prevention mission. And so we should be doubling their HIV prevention budget, and we should provide at least the $1.3 billion, which we're calling for with regard to a new PEPFAR for the United States of America. And $1.3 billion is still a drop in the bucket. And at the same time, we must do a better job of building capacity and targeting services within communities of color. Targeting. To do that, again, we need to ramp up the funding of the Minority AIDS Initiative to at least $610 million, but I hate to even say that because I know that is just not enough. But understanding the politics of Washington, D.C., if we got to $610 million, we would be making one major step in the right direction. We basically stuck at about $400 million for the last 8 years, so we must fix that. We must fix it soon. Fundamentally, though, beyond the political will and beyond the funding, we need to have a plan. And it shames me that our nation, 27 years into this global pandemic, still does not have a national strategy to combat HIV and AIDS. Still, we don't have that. If we can require other countries to have a national AIDS strategy before we give them funding through PEPFAR, then the least we can do is put together our own national AIDS strategy with a dollar amount attached to it. Like PEPFAR, such a strategy must orient our domestic AIDS response towards achieving clear and ambitious objectives in terms of reducing HIV infection rates, increasing access to care, and reducing racial and ethnic health disparities, which has got to be a part of any national strategy. It must build stronger partnerships between communities and our public service agencies, and it must include a commitment to rebuilding our healthcare infrastructure in communities around the country, and it must include universal health care, because you cannot tell me that 47 million people uninsured in the wealthiest and most powerful country in the world is not a shame and disgrace. And so we have to correct that and do the right thing soon in our own country. In short, we must translate the lessons that we have learned from implementing PEPFAR to our own domestic HIV/AIDS epidemic. We do need a version of PEPFAR for the United States. So, you know, some say that that's pie in the sky, you're dreaming. I say, yes, we can. I say, yes, we can, and yes, we must. Many said, and they told me in Toronto, that I was dreaming by wanting to have an international AIDS conference in the United States, especially in my own city in Oakland, California, and that we could never repeal the travel ban. I said, yes, we can, and we did repeal it. Now we've got to get the regulations done. Many said that we would never get a chance, or we would never, under the current political environment, get rid of the abstinence-only provision in PEPFAR. But we did. We got rid of that. So I share this with you because I want us to be encouraged out of this conference to go back to the United States and to organize and mobilize like we've never done before. This requires political action. We cannot separate what CDC's reports and numbers have been and what they have presented to us, which has been shocking, quite frankly, to the world. We cannot take the Minority AIDS Institute report left behind and leave it alone. We've got to organize around this. We've got to insist that all of our candidates for public office support what's in this. And we've got to insist that part of what we do in our social justice movement includes a call for a national strategy, a national plan, and a domestic PEPFAR. We have to hold every candidate for office, city, state, county, and yes, our presidential candidates accountable to put this on their agenda as they take office in January. And you know who I'm working for to make sure that happens. Thank you.